Hello, I'm Dr. Gregory Kotlars, licensed psychologist and executive director of Seniors Wellness Group. I'm here today to talk about ways of coping with the stressful effects of the COVID-19 pandemic, and especially for essential healthcare workers from the long-term care community. Virtually all aspects of our lives have dramatically changed as a consequence of COVID-19. These changes represent special challenges for adaptation and adjustment and forms of stress that can adversely affect both physical and psychological, emotional health and well-being. The stress arises from features of the COVID-19 illness itself. Its novelty, relatively easy and multiple ways of transmission, rapid progression, absence of a vaccine or cure, and potentially severe and even deadly consequences. The problems of testing and detection of the illness, deficient supplies of personal protection equipment, and other medical supplies, devices, and accommodations significantly compound matters, especially for the healthcare worker community. Essential healthcare workers are even further challenged by balancing the demands of caring for one's patients, families, and oneself, along with having worry about inadvertently exposing their families to the coronavirus. Then we have all of the hype, half-truths, and false information coming from sources of the popular media and politicians alike, along with a lack of coordination among local, state, and federal governments on what needs to be done to help mitigate and respond to the challenges and problems associated with the pandemic. People are confused, worried, afraid, frustrated, and angry. Others are depressed and grieving over their losses. The worries that folks have about themselves, their families, finances, and work can be overwhelming for so many. Social distancing has further disrupted our daily routines and traditional support systems. That in turn has created a serious problem of loneliness for many. The uncertainty and fluidity of the rapidly changing state of affairs burdens our personal resources further for successful adaptation and adjustment. So what can be done to help mitigate the adverse effects of these conditions and to cope with all of the associated stress so that the essential healthcare worker is not becoming ill or seriously distressed themselves and can continue delivering the patient care that is so badly needed? The first thing I want to speak about in this regard is the concept of control and the desirability of reestablishing a better sense of control over our lives. Currently, so much may seem to be out of control in our lives with the prevailing conditions of uncertainty, rapid changes, misinformation, and multiple new challenges associated with COVID-19. Daily routines have been turned upside down, and we want to take direct action to restore better structure and organization in our daily lives. This can help things seem more predictable and secure, and in turn help lessen one's fears and anxiety. Similarly, we feel more in control of our lives when there is less uncertainty about important matters. And accompanied by plans of action that are based on solid, true information, we can feel more confident and less anxious about anticipated outcomes. So another thing we can set out to do is to seek reliable sources of information about the COVID-19 pandemic. We want to avoid popular media sources that misinform and sources of social media as well about the pandemic. Avoid the opinions of non-experts and politicians. Conversely, rely on sources that are grounded in science. Listen to the scientific experts in their respective fields for information and guidance. Information that comes from reputable educational and research institutions and agencies such as the CDC, National Institute of Health, and renowned universities and medical institutions across the nation. At the same time, on a more practical level, set a goal of limiting your time in accessing such news and information on a daily basis. Whether this is 30 minutes, once or twice a day, or something differently. Then once you've reached the established limits that you've set, turn the device off, put it down, put it away, and move on to what's next. It's important to stay informed, but you have other important needs that require due attention, that support personal stress management and your emotional and physical health and well-being. As already mentioned, reestablish a daily routine for yourself and family, and be sure to include a regular mix of activities that includes things recognized as meaningful, pleasurable, and productive. Include self-care activities of personal hygiene, exercise, and healthy eating, while avoiding the use of alcohol and other drugs as a misdirected form of coping. Rather, be sure that you're receiving proper nutrition and adequate hydration from non-alcoholic and non- or low-sugar beverages. These can help build your immune system. For example, you can also set goals of eating 3 to 5 servings of fruits and vegetables a day. Appreciate the performance of daily exercise as a reliable means for lowering your stress response and contributing to your physical and emotional well-being. Set similar daily goals for exercise. Consider 30 minutes of exercise a day, 5 days a week. Based on current science, exercise and diet may in fact be the closest things we have to a magic pill that support achievement of these goals. Include time on a daily basis for complete separation from the rigors and stresses and strains of the day, and take time just for yourself. You can take brief moments of a minute or so throughout the day for active relaxation. Focus on your breathing. Take 2 or 3 deep breaths in succession, filling your lungs deeply and fully with air, then slowly exhaling over a span of several seconds, while at the same time envisioning the muscles in your body loosening from your head to the tips of your toes and fingers, and see the tension being expelled with each instance of exhalation. Also, try to stay aware of your conscious mind, to pay attention to things in the present moment, non-judgmentally, to be fully present, aware of where you are and what you're doing, and not be overly reactive or overwhelmed by what's going on around you. This would represent a mindful approach to managing your stress. Pause. Avoid and correct faulty thinking or cognitive distortions, which are exaggerated or irrational thought patterns involved in the onset and perpetuation of feelings of emotional distress. For example, all or nothing thinking. Saying to yourself that things are always a certain way or that something will never happen, when the truth or reality is more likely to be somewhere in between these two extremes. Or there's jumping to conclusions, where you reach a conclusion or believe something to be true, especially something negative, without sufficient evidence or support for the idea. For example, concluding that someone must have done something because they don't care about you, based on a single instance of the person not addressing you directly in a group conversation. This can be, again, an example of jumping to conclusions, which in turn can bring on some troubling emotional feelings. Or catastrophizing would be another example of irrational thinking that can fuel a stress response. This is predicting a negative outcome and jumping to the conclusion that if the negative outcome did in fact happen, it would be a catastrophe. Rather, to think more rationally about the situation, we would want to consider other possible outcomes, or positive predictions, neutral predictions, and mildly negative predictions, not just very negative ones, and make a distinction between something being significantly unpleasant and it being an actual catastrophe. By decatastrophizing, you are more likely to believe that you can cope with negative events, and your anxiety will be much less of a problem for you. These are some cognitive restructuring approaches to stress management, also consistent with an approach of mindfulness. There are a few links that are shown below this video on our website for the use of online tools and apps to help you learn active relaxation exercises and mindful approaches for stress management. Such approaches are well established in evidence-based science for managing stress and the support of mental and physical health, along with bolstering one's immune system. Also, and very importantly, we want our daily routines to include time for staying connected with others. While there are now limitations created by physical and social distancing for what we can do socially, it may be more important than ever to sustain social connectedness. Research has long demonstrated the illness effects that social isolation and loneliness can have. For example, persons who lack this feeling of connectedness to others are more likely to catch a cold. They're more likely to experience depression, contemplate suicide, develop heart disease, have lower cognitive function, and to live a shorter life. In fact, the long-term harm resulting from chronic loneliness is now put on the scale of chronic tobacco smoking and obesity. So we want to make use of telephonic and audio-video electronic methods and programs where and when necessary to substitute, due to these restrictions placed on social connections by physical distancing and lockdown. We want to promote a sense of calming, hope, gratitude, and positivity. Each day, try to find a positive story in the news or in your life experience that illustrates resilience and positivity amidst challenge. Allow yourself to reflect on one personal gratitude each day. Similarly, find occasions and information for expressing hopeful messages regarding COVID-19 and its course, successful societal responses and adaptations, along with inspirational stories of healing and transcending challenging circumstances. Recognize and appreciate your special role as a healthcare provider in the long-term care setting, where so many of your patients and colleagues are troubled by many of the issues we've discussed, and your opportunities for helping these persons and for altruistic acts. Look to support one another in ways that you can. Appreciate your efforts at encountering the formidable challenges of your job. Work with your colleagues as a unified team. Stay connected with one another. 1. Slow down your pace of work with your patients and engage them in conversation and interaction, even those whose verbal communication is impaired due to neurological illness and impaired cognition. Be a source of factual information for those who can understand so that you can help allay their fears and anxiety. Make use of visual stimuli to facilitate communications where necessary, and assist your patients with the use of electronic media when available for staying connected with their loved ones. And again, recognize the value in these personal behaviors of yours. Give yourself credit, a pat on the back, and or some other small reward for your efforts, and actually even for your original choice of a profession that puts you in service and care for the health and well-being of others. 1. Also, remember that empathy and acts of kindness in any form can be most powerful in helping to support and guide others through such challenging times. These simple qualities and actions can cut deeply through layers of worry, fear, frustration, and distress, and open one up to more positive ways of thinking, feeling, and behaving. And just to provide a couple of quotes that speak about the meaning and significance of acts of kindness. Some quotes, a couple of quotes from one of the great writers and authors of all time, perhaps, Leo Tolstoy. Nothing can make our life or the lives of other people more beautiful than perpetual kindness. Kindness is for your soul as health is for your body. Practice kindness all day to everybody, and you will realize you're already in heaven now. Now, in summary, the objectives and techniques to target for stress management include adopting an active approach to stress management, reestablishing daily, structured, and organized routines to help restore a sense of control. Seek reliable, factual information about COVID-19 from scientific sources and experts. Place a daily limit on your access and attention to news and information about COVID-19. Maintain a focus on self-care and personal healthy habits that support your immune response. Set concrete goals for yourself accordingly and day to day. Remember that a healthy diet and regular exercise are key ingredients. Avoid using alcohol or other drugs as a means of coping. Take time for yourself to separate from daily stresses and strains, including time for active relaxation and mindfulness practices. Try to keep your conscious thoughts focused on the present, the here and now, things that are being experienced moment to moment versus on matters of the past and future. Try to stay aware of your self-talk and automatic thoughts, and avoid distress-producing thought patterns such as all or none thinking, catastrophizing, and jumping to conclusions. Very importantly, stay socially connected. Try to promote a sense of calming, hope, gratitude, and positivity. Appreciate your role as an essential healthcare provider and give yourself credit and small rewards for your dedication, hard work, and the caring provided to your patients. Seek support of others when grieving losses experienced in your role as a healthcare worker as well as in your personal life. Finally, I have a prepared an addendum specifically discussing coping with grief and loss. So now I want to speak about these matters of coping with one of the most unfortunate and tragic consequences of COVID-19, and that being the death of others, especially loved ones, colleagues, patients, and others whom we may know and care about. This is indeed one of the biggest challenges in life, coping with the loss of someone we love or care about. So first, we want to understand that the grief we have for such a loss is a perfectly normal response. There's no right or wrong way to grieve. There's no set timetable either for grieving. The grief response among people varies considerably. For some, the response can appear relatively mild and brief, and for others, it can appear just the opposite, severe and prolonged. But in both instances, and everything in between, the grief response is different from one of clinical depression, which is broader in scope and effect, where often feelings of emptiness and despair are constant. Other symptoms of depression can include intense, pervasive sense of guilt, feelings of hopelessness and worthlessness, suicidal ideation, psychomotor slowing, and severe impairment in daily functioning. The grief response, on the other hand, is narrower in scope and focused almost entirely on the loss and what it means to the grieving person. Common emotional symptoms include initial shock and disbelief, feelings of sadness, moderate guilt, anger, and fear. Other symptoms can include fatigue, changes in appetite and sleep, and perhaps other mild to moderate physical symptoms that accompany lowered immunity in the grieving person's physiology. Evidence-based study has shown no effective response for grief from antidepressant drugs when compared to placebo, whereas the opposite can be observed when antidepressants are used to treat major depression. The grieving person, however, wants to be aware of the changes in their behavior and functioning consequent to the loss of a significant other, as the trajectory can change. Symptoms can worsen over time and create a state of complicated grief or even clinical depression. These conditions, however, represent other issues in their own right that exceed the purpose of the present talk. Grief, pause. That the grieving person wants to monitor their grief response, and if there is a steady pattern of worsening or progression of symptoms with corresponding impairment in daily functioning, then the person is advised to seek professional consultation with a mental health specialist. Or should the healthcare worker, following the death or other trauma involving a patient or another in the workplace, find themselves experiencing repetitive intrusive thoughts, images, or dreams of the traumatic event, a sense of hyperarousal or acute reactivity in themselves, intense discomfort about or upon re-entering the workplace or being in the workplace, or other unexpected changes in behavior and functioning. These may be symptoms of post-traumatic stress, and again, consultation with a mental health professional would be recommended. One of the keys for coping with death of a significant other is not to isolate yourself and to seek social support of others. The pain of the grieving person can cause one to want to withdraw from others and retreat into a shell. However, speaking with and having face-to-face support of others is vital to healing from the loss. And it's not that one needs to be always talking about the loss. But comfort also comes from just being around others who care about oneself. People also reach out themselves because they care. But the grieving person wants to understand and accept that many people may feel awkward when trying to offer comfort during these times and can even end up saying some of the wrong things. However, the grieving person does not want to use this as an excuse for retreating into one's shell and avoiding further social contact. Certainly, during times of loss, people also want to draw comfort from their faith as that applies. People also want to take care of themselves when they grieve. The stress involved from the experience can quickly deplete one's energy and emotional reserves. Looking after your physical and emotional needs will get you through this difficult time. Face your feelings rather than trying to suppress your grief. In order to heal, you have to acknowledge the pain. Avoidance, rather, may only prolong the grieving response. Try to maintain your usual life roles and activities as soon as you feel able. Don't allow others to tell you or to determine how you're supposed to feel, and don't try to do the same yourself. Feelings and behavior can vary considerably, and as stated, there is no right or wrong way to grieve. Look after your physical health, and if finding yourself having sustained or incapacitating physical symptoms, seek medical consultation. Finally, plan ahead for grief triggers such as anniversaries, holidays, and milestones, and be prepared for possible reawakening of memories and more intense feelings of grief at those times. When roles are reversed and we are the one in a position of offering support to another who is grieving, remember that the most important thing we can do is to listen. That is, listen when the grieving person may open up and want to speak about their loss. You can feel free to then talk candidly about the death of their loved one when it seems appropriate, and even to ask sensitive questions that invite the grieving person to openly express their feelings. Keep in mind that the grieving person needs to feel that their loss is acknowledged, that the death and loss are not too terrible to talk about, and that their loved one won't be forgotten. Accept the person's feelings, whatever they may be. Be genuine in your communication. Be willing to sit in silence and offer your support or assistance with specific tasks that you think may be helpful. Things to avoid saying include such things as, it's part of God's plan. Look at what else you have to be thankful for. He or she is in a better place now. You need to put this behind you now and get on with your life. Or telling the person other things that they should or should not do. All things to avoid. Unfortunately, right now, traditional ways of receiving and providing social support and working through the healing process of grief have been currently disrupted by lockdown conditions and social distancing. Funerals, wakes, and religious ceremonies and memorials are not available under these current conditions, nor are there the same opportunities for direct personal contact and interaction with others. However, as discussed, we still want to stay socially connected by using the telephone and other forms of electronic media. We can send cards with written messages or letters in expressing our condolences. We also can read or write similar messages of support and condolence in online guest and memorial books. Then, once all of the current matters of lockdown and social distancing are finally behind us, there are likely to be instances and opportunities for more traditional memorial services and gatherings. The need for ongoing social support remains significant, however. once things have settled down and returned to normal following such major disasters. So keep checking in on the people who have suffered the loss of a loved one or experienced a similar trauma from the disaster. It's important and it remains desirable to keep the support going. And that completes my talk for today. Thank you for listening, and good luck in continuing the service and care to your patients.